I'm going to talk and just talk about the program, and then if anyone feels you can either hold your questions till the end, or as we're going through it, if you want to raise your hand or just kind of come on camera, or just give a shout out, whatever it may be, then I can ask your questions as you go along as well. So however you want to do it is fine. I'm going to get started. My name is Melissa Looney, and I am one of the faculty members in the Department of Speech Language Pathology here at Misericordia. I have been, excuse me, part of the department for the past 6 years. I'm a clinical supervisor and part-time and adjunct professor. My background is in primarily long-term care, working with adults. I am a graduate of Westchester University and Marywood University. They did not have 5-year programs back then. But I've been in the profession for about 20 years and switched, I always was a fieldwork supervisor, but then switched to teaching here at the university 6 years ago. So as I said, most of my career has been in long-term care and rehab settings working with adults, but now for the past 6 years, I've been working with children in our outpatient clinic with all disorders. I still do some home health with the adult and geriatric population, and then I also work in early intervention as well at one of our contract sites here. I'm going to start off by just talking a little bit about speech pathology in general. It is a profession that is extremely variable and vast. You can really do a little of everything. You can specialize in one area. You can change your path, your career path throughout your career. It's really kind of what you make it. Some people work only in one type of setting with one type of population for their entire career. Some people do a little of everything like me. Some people switch, you know, every couple of years. What's nice is that there's so many different opportunities for us. The job market is always very plentiful. You know, maybe when Medicare is going through turmoil, kind of like it is right now, jobs in the rehab and nursing home and hospital settings aren't as abundant. But yet 20 years ago, when I was just starting, insurances and Medicares and reimbursement levels have completely changed, and there was no therapist in the home. So everyone wanted rehab therapists and started building programs, and you know, we're hiring 3 to 4 speech therapists in one nursing home. Now you're lucky if you get one. So, you know, with the changing times, the need for therapists in different setting changes. A difference from 20 years ago is now there's so many more special placement schools and special needs schools that have developed for children with autism and multiple handicap disabilities. So the need for speech therapists in those schools is more plentiful now because there's so many more you know, schools that are out there. Unfortunately, there's always people who are going to need a speech therapist, you know, but lucky for us, we have the profession that we can help these individuals that need it. Whether it be, you know, if you're working with a preemie in the NICU, or you're working with someone who, you know, is actively dying or is in hospice care. We truly go throughout the entire lifespan, and we work with anything from the tip of the esophagus to the brain. So anything that has to do with any of those organs, that's our specialty. So whether it be swallowing, voice, speech and language disorders, fluency disorders, literacy disorders, and then everything that kind of falls in between. That's what we work with. Hearing, auditory processing. You know, it's really just a really nice array. Any questions about the profession in general? Okay, everyone have some idea of, you know, what the profession is about, you know, some knowledge of speech therapy, obviously some knowledge if you're choosing this program. Okay, so now I'm going to talk a little bit about our program at the university. So we have been established since about 2006, and we are a 5-year master's level program. So it is an accelerated program, meaning that in those 5 years, you come out with a master's degree ready to practice. Without a master's degree, you cannot practice in our profession. So you do need to have the master's. A lot of programs that are out there have a 4-year bachelor's degree, and then you have to apply to graduate school for a 2-year graduate degree. Some schools, you know, like examples, Westchester, LaSalle, you know, I'm thinking off the bat, Penn State, they have four-year programs and they have graduate programs, but even though you're an undergrad, does not mean that you're automatically admitted into their grad program. So you still, no matter what school you go to for a four-year bachelor's degree, you still have to apply to graduate school, even if it's that same school you just went to for 4 years. So you still have to apply, you still have to take the GREs, you have to go through the whole process as if they don't even know you or hadn't known you for the past 4 years. It's stressful, for sure. That's, you know, I went through it, and you know, it's very competitive. There's not a lot of spots in the graduate level programs, and you could be, you know, a top student and have a super high GPA, but there's also 60 some other students that have that same GPA and that also, you know, are so academically strong. So it's kind of just luck of the draw at that point. 5-year program, once you're admitted, and as long as you maintain a 3.5 GPA, you're good to go for those 5 years. You've cut a year off of your schooling, and you do not have to apply to graduate school. You're not competing with other students. You do not have to take the GREs. So kind of reducing the preparedness part of it, reducing the stress level part of it, and cutting a year, like I said, off of that schooling is huge. It is an accelerated program, so it's certainly more intense than a 4-year bachelor's, 2 years grad program. You know, at the junior level, I mean, really from the beginning, you have you're looking at 17 to 18 credits a semester, but you're getting those speech therapy classes, you know, right on from the start. So by junior year, you're basically done. 3rd year, you're basically done with your gen eds. I think you have like 1 gen ed to take each semester. And I'm gonna send you an actual copy of how we break down all of the courses and all of the classes over that 5-year period. You start treating clients as a junior. So as your 3rd year in, you actually get your own clients that you work with for an entire semester and part of our clinic. And then you have 3 other clinics throughout your time, throughout your graduate period, that you are working with clients. You could be treating, you can have 6 to 12 clients that are your clients. You are the therapist. You are treating them for that entire semester. So you really get good hands-on learning, hands-on experience with, you know, learning how to actually do the therapy, which is what our profession is all about. Your 5th year, and just backtracking a little bit into the actual schooling and the classes, your 5th year is your fieldwork year. So during that 5th year, if you're from out of the area and you want to move back home, you can certainly do that. A lot of our students do that because they want to save money. You know, they like being at home. They don't want to necessarily be away. So, you know, usually within a 2 to 4 hour radius, our clinic director will approve some type of site that's closer to your home. And then you don't even have to be here for that 5th year. So it's truly, you know, you can kind of think of it as like a traditional 4-year program where you have to be here on campus, but even though it's a 5-year degree, you don't even have to be here that 5th year. It's an online class each semester during that 5th year in addition to your field work. So, you know, it's easily managed from home, and I would say probably 90% of our students that are out of the area do take that option, which is nice. In talking about our field work and talking about our clinic a little bit, we have a very large outpatient clinic. We are open 5 days a week, all year round, except for when we're closed over the December break, the winter break, and and August, when after summer sessions and before this fall semester starts. So we're really open all the time, morning till evening. We see clients. We have about 9 treatment rooms in our clinic, so we can really see a lot of clients at the same time, which gives our students some great opportunity to actually do the therapy. You know, which is another reason why we can give everyone a lot of those clients right from the start. Lori Semino is our clinic director, and she, in terms of field work, she sets up your field work sites for you. So that 5th year, when you're doing all your field work, like your internship placements, she is setting those up, getting those contracts. You just have to really, truly maybe give her some ideas of where you might want to do the fieldwork experience. And she does her best to get you into your top choices. And if not, you know, she works really closely with you. Again, like I said, this program's been established for a while, so she has a lot of contacts already set up, a lot of contracts already set up, and she just does all of that. So you don't have to worry about finding your internship sites. it's all taken care of for you. In terms of some of the other schooling part of it, we have professors who, oh, I'll get to that question in 1 minute, Emma, good question. We have students who we have professors who specialize in a lot of different areas. So it's nice to have those, a faculty of those PhD level professors. You can go onto our webpage and actually see them and see their work. And with those professors, we have clinics, and I'm going to give you a virtual tour of our clinic later on. So we have an actual hearing booth where you can go in and do the testing, you know, with the headphones and the audiometer and doing all that. We have our own sensory motor gym. So it's a whole gym designed specifically for those students with sensory needs, those students with autism. So we have a ball pit and swing and just cabinets and cabinets full of different games and toys that we use with our clients. We have an anatomage table. So it's a large anatomy table for virtual dissection, which is pretty cool. We have an AEC lab. So a lab specifically designed with all different kinds of augmentative and alternative communication equipment. So, you know, whether it's an iPad with apps on it or a Dynavox machine or some type of machine for those students or those individuals that are nonverbal, and that it's a way for them to communicate. We have a huge voice lab. So Dr. Carrie Tallis Voice is a specialty area in our field, has her own voice lab with all different kinds of equipment. We have a fluency lab, with again, all different kinds of equipment. And we have a neuro lab with all different types of equipment for neurological components and to assess neurogenic disorders. So we do have, like I said, a nice faculty who specialize in all of these areas with all the different equipment and rooms available for them. With that comes research. Our faculty is very involved with research, and then we get our students very involved with research as well, whether it be from the time you come in or something that you choose to do at some point throughout your career here. But our students have presented internationally and nationally for years and years at national conventions and conferences and international conventions and conferences, from Japan to Italy to Portugal, Oxford, I mean, kind of all over, and then all over the country, wherever our national conferences every year, and then at the state level. So we usually send 20 students every year to our national conventions and state conventions to present their research, to, you know, they have their names published in these professional journals at 18, 19, 20 years of age. So it's pretty cool. You don't have to do research, but if that opportunity interests you and that's something you'd like to get into, then that is available for you as well, which is nice. In talking about, there was a question about, let me just read it really quick and I can talk about that. Are you paying graduate rates starting in the 4th year or only the 5th? It starts at the 4th year, so that's a good question. So after 4 years, you graduate with your bachelor's in health science degree. So you walk at graduation, you get a bachelor's degree diploma. However, after those 3 years and your 4th year is considered your graduate school year. So the 4th year is all grad level classes, and that 5th year is all grad level field work. So it changes from undergrad those first 3 years to grad for the 4th and 5th year. However, you don't get the diploma until after your 4th year bachelor's. And then and then 1 year later, you get your master's degree. So did that answer your question, Emma? Yes, okay, good. Good question. How many students are in the program? A great question. We cap it at 40. And it doesn't mean that there's 40 right from the start. So usually coming in, we have an average of 30 to 35 students per class. You know, 1 or 2 may drop out, change majors throughout the course of the time. And then we always acquire transfer students or graduate level students. So depending on how many spots we have left in the program, and depending on Dr. Tallis, he's the chair of our department, depending on, you know, how he thinks these transfer students are academically and graduate level applicants are academically, he will admit them himself. So it really all depends, but we do cap it at 40. Right now, our graduating class for this coming year is at 40, and the graduate students this year, the fourth year students, are at 40. So that's usually where we go. It's usually pretty packed. However, 40 is still a small number in the grand scheme of things. So what's nice is that as you're going through your classes, there's usually 2 sections. So in your class, you're not going to have more than 20 students in a class, because Dr. Tellis likes to split it up and split it into sections to have more one-on-one, you know, smaller class size for just better integration and better teaching and learning styles. So it's 40 is still a smaller number, but then it, you know, and then when you break it up even into those classes, it even goes into a smaller number. You know, as you've learned from Misericordia, you're welcome. As you know from, or learned from Misericordia, you know, in some of the open house information, it's a smaller campus, it's a smaller school. So, you know, the programs are going to be smaller than, say, Penn State, you know, or somewhere like that. There's a question for, is there an early decision date for this program? Basically, admissions, it's rolling admissions. So once you get, if you get, admissions is the one to accept you into the university and the program, unless you come in undeclared. So if you're coming in with an interest in this speech pathology program and you're wanting to be admitted under the speech pathology program, you know, as long as that application's in and all of the other stuff that goes with it is in, they do that assessment and they can start, and they will start admitting. So I think they start right around now, actually. Maybe even a little bit earlier, but admissions would be the one to answer that question for you. But it is rolling admission. Did that answer your question, Gina? Yes, okay, good, thank you. I'm trying to think if there's anything else, if not that we're, you know, doing this right now, but study abroad has always been an option, and a lot of our students have always done that. And usually that takes place during your sophomore year, fall of your sophomore year. So if that's something you'd like to do, we just ask that you, you know, let your advisor know coming in so that we can plan accordingly. Any questions about any of the information I've said so far? Okay, would there be any issuing practice in CA with my PA Masters? Another good question. So actually, let me talk about licensing and certification. So as a speech language pathologist, you need a master's degree to practice. Like I said, you need to have graduated from an accredited university, and Misericordia is an accredited university and has been back since 2006. ASHA, who is the American Speech Language Hearing Association, is our governing body. So that's who gives us our accreditation. That's who tells Misericordia, yes, we accept you to be an accredited program. These are our rules and regulations. This is what we follow as practicing clinicians and as training, you know, university and teaching programs. So ASHA says that you have to graduate, you know, from an accredited university. You have to have 400 clinical hours to graduate. So 25 observation hours, which you get your sophomore year, and then 375 clock hours from treating. So that's what's great about our clinic that we have, and that we give our students hands-on treatment experience at their 3rd year. So by the time you leave at your, you know, at the end of your 4th year, you're probably coming out of here with at least 100 hours, which would leave about, you know, whatever's left, 275 at your field work site. So you're really getting a lot, sometimes more than that, depending on, you know, the amount of clients you have. If you do extra clients, you know, sometimes that opportunity is there. So ASHA requires those hours. ASHA also requires, well, Misericordia actually requires that you pass our comprehensive exam. So in December of your 5th year, you take a exam for the department. It's a 4-hour essay test, and you have to pass that to graduate. If you don't choose to do the exam, you would then write a thesis. So you would choose a research topic, and you would write, you know, defend your thesis, do research, and you would present that in May. But regardless, if you choose the thesis or you do the comprehensive exams, you have to take a national exam for ASHA. So every speech language pathology student in the country has to take this exam. You don't have to pass it to graduate, but you have to take this exam and pass it in order to be accredited. So usually our students will take that right after they take their comps in December because everything is fresh. Some will wait a couple weeks and take it in January, but usually by January, end of January, all our students have taken that national exam, which you just take out like a Sylvan Learning Center. It's a computerized test, someplace like that. In the past 6 years, we've had 100% pass rate on that exam. So all 40 students in the graduating classes have passed that exam, which is great. So that lets us, that should be reassuring to you and reassuring for us to let everybody know that clearly we're giving you the education that you need, that ASHA is saying that you need, so that you're passing their exam to get your accreditation. In terms of licensure, that varies by state. So in the state of Pennsylvania, once you graduate, you start working like anybody else, getting paid, it is a real job, but you're working under a temporary license. So it's usually for about 9 to 10 months. The Pennsylvania State Licensing Board requires that you have another so many hours that are, under a licensed and certified therapist in the state of Pennsylvania. So it means that you're getting some extra supervision, someone to kind of check in with, make sure that you're doing okay, providing, helping you along. And then at the end of that 9 to 10 month period, you send in some paperwork, this supervisor proves that you've done all that you need to do, and then you get your license in Pennsylvania. And then at that same time, you've met the requirements for ASHA and you get your certification. So ASHA also wants you to do this, temporary, licensing type of period as well. And then you would get your CCCs, which are your Certificate of Clinical Competence. So in order to be a practicing master's level clinician, you need to get those Cs. So you always, you might see like CCC-SLP at the end of a speech therapist name, and that's what that signifies. So it doesn't matter if once you're accredited, you can practice anywhere in the country. You just have to apply for that state license that you're going to practice in. So New Jersey, I hear, is extremely simple to get. Usually the states, you just kind of have to submit all your recent, your transcripts, your scores from your test, your clinical hours, things, basically all the stuff you've just done. You just have to submit to them, and then you renew that license every so many years, depending on what the state board has. Now, perhaps by the time you graduate, there'll be universal licensure. ASHA is really trying to push for that. So they're trying to negate all the state board licensing systems and just say, listen, if you're accredited, you've passed all of this, you've done all this, we're saying that this person can practice speech therapy in this country, why can't that just be the same for every state in the country? So, it's something that they've been going through and been really pushing for, something we support. I've had license in a couple different states, and some states are so easy to get and some are just a pain. It's just so much paperwork. They want to know your congressional district. They want to know where I observed back in 1998. Again, I have been practicing for 20 years. Why can't I just get my license to work in your state? So, so every state is a little bit different, to answer that question. Another question here, do the students get paid during their 5th year? Unfortunately, no. Unfortunately, you have to pay for that. So it's 12 credits a semester because it's a learning teaching experience. That's how you're getting those 400 hours. So, maybe in the fall of that 5th year, you go to an elementary school, like your old elementary school even. And then in the spring of that 5th year, maybe you want to work in a hospital or a nursing home, some type of rehab adult. We try to encourage a pediatric and an adult placement so that you're getting kind of, an experience with both populations. But it is like going to work and coming home, but it is field work and an internship, so you have to pay for it because you are getting those clock hours that you need to graduate and complete your degree at the university. Teacher certification, another good question at the end of that 5th year. So the state of Pennsylvania, a few years ago, back in like 2018, said that you don't need a teacher certification to practice in the schools. They switched it over and said you just need this educational specialist certificate, which again is basically you just sending some papers to the Pennsylvania Department of Education, separate from the Pennsylvania Licensing Board in Speech Pathology, and saying, I would like the certificate so that I can work in the schools. And they say, you know, they basically say, okay, give me $200 and some and we'll say you can work in the schools. I just got mine actually 2 years ago because I haven't worked in the schools up until then. And I never got the teacher certification when I had graduated. So that's how that works. Some people, some individuals in speech language pathology programs will still go for that teacher cert just because, you know, some school districts may want it, even though there's the rules that they can't have it, or they just kind of want to have it just to have it. If that's the case and you're going for that full teacher cert, you know, there's additional classes you have to take and there's additional tests you have to take through the Department of Education. But we just guide you to the Department of Education at the university at that point. Kind of out of our hands. It's just some supplemental things that you have to do. We just send you right to the Department of Ed that's here, and then they guide you and take care of that. But again, in the state of New Jersey and the state of North Carolina, everyone's a little bit different with that teacher cert. So, you know, it's all a state by state basis as to what requirements they have for you. I hear, again, New Jersey is also very simple, kind of like Pennsylvania. So that answers the question about New Jersey. Has it been difficult treating patients with COVID? That's a great question. Actually, it really has not been. We have had a teletherapy clinic going on since March, since the world shut down. And teletherapy is actually, has been established and has been going on in our profession for years. Some companies out there are strictly just teletherapy companies. So now, you know, it's obviously becoming very popular because it's the only safe way for us to actually, you know, treat our clients. And it's been going really well. So it took, you know, a little while to figure things out, but we do summer sessions. So for our grad students that are in their 4th year, you have to stay for 2 summer sessions in between that 4th and 5th year. So up to the end of July. And there's 2 different clinics that are going on at that time. So all summer long, we did teletherapy, basically what I'm doing with you right now through Zoom. And now in our fall, we're doing the same thing. So our clinic has completely transitioned to online teletherapy services, and it's been going really well. We see great progress with our clients because the parents are usually right there, just maybe helping them navigate the screen. They're getting one-on-one learning. The carryover has been really good. It's been pretty successful, and our students have been getting good therapy. Everyone's safe. You know, it's convenient. We're all in the comfort of our homes or our apartments, or you know, maybe they're using one of the clinic labs at the university. But it actually has not been a challenge for our students and for us at all. It's been going really well. And I can even tell you there's in the school districts that have also been doing it. We have a contract with an early intervention center. We've been doing the same thing all summer long with the early intervention center through one of the local school districts as well. So again, the students are getting the hours, the clients and the school age students or early intervention students are getting their therapy. And it's been a great experience. It's kind of a whole new different aspect to speech therapy. You know, online learning is different. I'm sure you're all experiencing it right now. So it's just a different way. It's just a different way to do things, but we've been very successful. Okay, another question. Do you provide access to online resources to help with observation hours? I've heard there are some excellent resources available at some schools. So for online resources, there's actually a huge, I don't know what the word I'm looking for, but so much availability with different companies and different resources and online sites for speech therapy materials and tools in general for the teletherapy format. In terms of observation hours, I'm not sure about that just yet. So when the world shut down in March, most of our sophomore students who have to obtain their observation hours at that point had them all. There was probably just a handful of them that didn't. There are there's Master Clinician that's out there, and there's SimuCase, which are virtually based programs with real life cases that our students have been using. So some of those students who needed those additional observation hours were able to obtain them through these virtual sites that are ASHA approved. So ASHA says, yes, it's okay to get so many hours through these virtual sites. We've started using these SimuCases as additional ways for our students to gather some of those hours, because some of them lost some time, you know, with the transition between March to May in the spring. We've been using the SimuCase for teaching purposes. So yes, there are some great resources out there for, you know, virtual observing and teaching and learning, and actually a way to even get some of those clock hours still too. We'll probably be using a lot of that in the spring when our next round of sophomore students come up for their observation time. You know, I don't know how they will be, you know, I don't know if the opportunity is going to be there, if school districts are going to let them in to observe, if rehab settings are going to let them in to observe. They'll probably be doing a lot of teletherapy observation as well. But yeah, we'll definitely be dipping into some of those resources for those observations too. So you are right about that. Great questions. Anything else? Any other questions anyone can think of? No? Okay, I'm going to share a video with you now then that we have. I think I answered all of the questions that came up. If I missed something, please let me know. Let me just pull up. I'm going to give you a virtual tour of our department now. So traditionally, if you were here on campus for the regular open house, the students, some of our students would be providing you tours in Passon Hall, which is the building that our department is in. It is about a mile down the road from main campus. It's the health science building. It was built back in around 2010. So it's PT, OT, speech, and nursing that are in this building. And speech therapy, we have the whole second floor. So the entire floor is ours. It's a huge, which gives us tons of clinic space. So again, that's why we see so many clients and we can get so many clients into our clinic. And then you'll get to see our labs, even like our observation rooms, our meeting areas, our lobby. You know, I'm going to show you all in this video here, which is good to see, because as you're comparing other programs, you know, you can sort of compare the facilities. When I was looking into graduate school, you know, I wasn't sure, you know, I had gotten into a couple and I wasn't sure what I wanted to do, but I completely ruled one out because we went there and the clinic rooms were in trailers. And I had just come from another school where it was like just built, and they had this beautiful lab, all these beautiful labs and this beautiful carpeting and like cubbies and rooms with cameras and all this stuff. And I, you know, and I just kind of said, okay, I think, you know, I asked a couple of questions and I was just like, nope, this is not for me. So, you know, sometimes that might make or break your decision. Okay. If someone cannot see this, please let me know. Everyone okay? So that's a little bit, gosh, it makes me miss it. We haven't been there in so long. So that's a little bit about our department, and that's what it looks like. Like I said, you can clearly see how there's a ton of treatment rooms and labs, and the student clinicians room you will live in probably from 4th year on. You'll spend morning, noon, and night in that building. The pictures you saw are our students still working there now with their masks on, you know, socially distancing. So while the university is open, some departments are online. So our department has been online teaching, except for the freshman classes. But our students still have access to all of the labs and the materials and the clinic rooms and everything that's there, you know, just obviously following safety precautions and social distancing guidelines. You're welcome, Alyssa. Anyone have any other questions about anything? Okay, well, if you want to stay on and ask anything individually to me, you certainly can. Like I said, I have your email addresses that are on file with the university from Catherine, and I will send you, look for, there's about 4 documents that I will send you that outline your classes, that outline the profession, and that outline our clinic. So just some good highlights there. I encourage you to go to our faculty page and the speech language department page for additional information. There's additional videos on there that you can watch, and you can research some of our faculty members as well. So good luck to everybody. You're welcome. I wish you lots of luck in your endeavors and you're making your decisions, and in your applying and everything. I hope everyone stays safe and healthy. And if you have any questions, please, you can reach out to me. You'll have my email once I send you those documents. So, you know, as you're doing your research and you're making your decisions and you're visiting other university programs and questions come up, please let me know how I can help in any way. You know, we're happy to set up tours, more virtual tours. If you wanted more, you know, one-on-one time, whatever it may be, we can connect you to students. We're happy to help any way we can.